Hi, Mr. Smith. Dr. Moody, nice to meet you. Have a seat. So what brings you to the office today, Mr. Smith?
Lower back pain.
Lower back pain. Can you tell me something about your back pain? I mean, like, does it hurt right now when you're sitting like that in the chair?
24/7.
24/7.
All day long.
Is there anything that makes it feel better?
Pain medicine.
Ooh. Is there anything that makes it feel worse?
Life.
Mm-hmm. Well, you know, a lot of people seek out a chiropractor just for those reasons, for back pain. Not necessarily for pills, but for back pain. On your first visit, we're going to gather some information through examinations and consultations. And a staff member is always available to new patients. We don't leave you hanging to fill out forms, to fill out financial forms for the consultation forms. If ever you have a question or concern regarding your care, just ask. Somebody will be available to you. Anything we do is held in the strictest of confidence, and nothing will be done without your consent. Are you comfortable with that so far? Do you have any questions at this point? It's equally important that I find out about you as well as you finding out about us, because this is your first adventure with chiropractic. You want to know things about how the office operates and chiropractic as a whole. How will it make you feel better? Will it make you feel worse?
What is it?
It's a series of examinations, and through those examinations we put together a plan that we think will best benefit your situation. But the end goal is to make you pain-free and for you to enjoy your life again.
Plus or minus injections.
No injections here. We do not do injections here. All right, let me continue. We try to minimize the paperwork in the office, so the clinical forms are all there for you, but we just have just a few. And you must fill out the forms accurately. I want to know medications that you're on, any type of injuries that you've had. Even though you might think they would be really insignificant, I'd like to know what those injuries are and approximately when they occurred. Now, I realize you're a more mature individual, but you need to try to pinpoint when those injuries happen, whether it's a fall on your bicycle when you were 10 years old or the fall down the steps when you were 25 years old. Anything at all that would have, any kind of injuries at all, just please list on the information form. Read the forms completely and thoroughly, and Mary is our new patient advocate. You'll have her number attached to one of the forms, and if at any time you have any questions, Mary is there for you. She has a direct line through that telephone number that you're going to be given. On the forms, there's a place to mark several objectives for your chiropractic care. Whether, and this would be today because you don't know a whole lot about it, whether it would be treatment only, just today, prevention, maintaining health, or getting your whole family involved in chiropractic. So far, is it going okay for you, Mr. Smith? And I'll let you choose the one that best describes what you're looking for today. Okay, so let's begin the process. The first thing we'll do on your first visit, we do 3 exams. One is a physical exam, one is a chiropractic exam, and the other is an x-ray examination. Mary, again, will help you through the gowning process, set you up with the x-ray equipment so you won't be going through this process alone. You'll always have a representative from the office to help you. Okay? Do you think it's something you want to go through with? Mm-hmm. All right. Well, can you make an appointment with Carla at the front office? She's the secretary that does the scheduling. And then I'll see you for the report of findings. That sometimes I call that ROF, report of findings. It was nice seeing you today, Mr. Smith. Okay. And okay, Mr. Smith, Are you back for the report of findings? Have a seat. You remember me, I'm Dr. Moody. All right, so we got the report of findings going on. You remember last time you were here, we did you okay? We did the chiropractic exam, the physical exam, the x-ray analysis. So we got everything of that in front of us today. And your report of findings, I think we've narrowed it down to what might be causing so much of that low back pain. The back pain that you described as causing so much pain it takes your breath away. And then also that you have a hard time lifting items. Is that still going on today? That was only a week and a half ago, but is it any better or worse? Same. Okay. All right, so can I show you on Scully over here where your pain's coming from so you have a better understanding? All right, we'll take a look over here. Can you see him from where you're sitting? All right. L3 that's bothering you. This is your sacrum. These are your hip bones right here. This is 5, 4, 3. This right here is where your pain's coming from. You have a subluxation in this area that is causing the radiating pain down your one leg. Really irritated by lifting, and you have some problems at night. I think we can help you with that. Now you have to excuse our primitive x-ray equipment. Next time you come into our office, our x-ray equipment will be all digital, and I won't have to use this primitive equipment that I have right now. Same thing here, but this is your own personal x-ray. These are your hip bones here. This is the sacrum. This is that area that is causing you a lot of problems right here, L3. I think we can help you with that. Is your pain better any time during the day? I know you told me last week, but you have it's 24/7. You have it all the time, and nothing makes it feel better or worse. Okay, well then my recommendation is that you follow through a chiropractic care, and we're thinking for 3 weeks at 2 times each week, and then we'll reevaluate.
Now, how long does it take to get feeling better?
Rule of thumb for chiropractic is you should be feeling really good at a 4 to 6 week window. If you're not, then we reevaluate. We go through another chiropractic exam, review the x-rays we've already taken, and see if there's anything that we may have overlooked. But I feel comfortable and confident
Last resort.
that I can help you with your pain. Last resort, if I cannot help you, I will not waste your money. I'll refer you to somebody that I think was better suited for your type of care that you might need. But I feel confident that we're going to be able to help you. Good? Mr. Smith, do you have any other questions? Anything about the report of findings from your x-ray analysis? Physical examination was excellent. For your age and the amount of back pain that you're complaining about, your physical exam is perfect. One slight thing was your blood pressure was just a little bit high, and with that I'd ask that you return to your medical provider and just have him look over that again. It may have been just a little bit high because you were in a new setting here at our chiropractic office, but I'd feel more comfortable if you went back to your medical provider just to have him look at that again, okay? I can only present you with the facts regarding your evaluation, which I just did. It'll be up to you to decide if the chiropractic care is right for you. Once the care has begun, it depends on variables such as age or lifestyle and whether you keep the appointments that are made for you. These are all under your control. So, Mr. Smith, do you think this is something you might be interested in, chiropractic care? Good. Well, let me welcome you to an exciting journey of taking control of your own health. My staff and I look forward to helping you achieve this goal. Let me give you Mary's number. It's at the bottom of this form, but in case you don't have it, she's our new patient advocate. If you ever feel lost, she can help you through the process. I don't want you to be frustrated with what goes on here in the office for a reason that you don't show up to an appointment. She's always available to you. Let's see, I look forward to seeing you on Monday. Have a great day, Mr. Smith. Thank you.